As far as I can remember back, I've always enjoyed science, and especially in high school, I really enjoyed my biology and chemistry classes. But it really wasn't until I got to college and I got to do some volunteer work in different medical clinics when I really knew that I wanted to pursue a career in medicine and be a doctor. Working with several doctors, including some oncologists, I really got to see the patient-doctor interaction and the relationship that could form over time. And that's one thing that really pulled me to be a doctor and also to be an oncologist, is that you develop these deep relationships with patients and get to be their doctor and be their friend for many years in some cases. We've had so many breakthroughs over the last 10 to 15 years. We have targeted therapies now that are trying to target individual cancer cells and spare these other cells to really target the cancer but not cause as many side effects as some of our old treatments. We have immune therapy where we're harnessing the body's own immune system to really fight the cancer in ways that have not been done before. And we're seeing some phenomenal responses in some patients. We're seeing patients who have stage 4 cancer in some cases being cured of their cancer with some of these treatments. But we still have a long way to go, and so that's what excites me every day, is trying to find new treatments and new ways to improve patient outcomes and to really focus on the patient. So we have these tremendous new drugs and are curing more patients than ever. In breast cancer, 85% of women are now cured of their cancer. But one of the big things that we're finding is that our treatments can cause problems that last for years and years for some people. And so a big area of our focus at Baptist is on survivorship care, to really try to limit the effects of the treatments we have to give patients and to try to help patients deal with some of the side effects that come from some of these tough treatments that we have to give. And so we're really trying to focus on the whole patient and not just the cancer, and try to be with them, not only during their cancer care, but afterwards, to make sure that they are dealing with some of these treatment effects as well as possible. Being able to follow patients over years during my training programs and develop those relationships really satisfied me tremendously, and I knew that that was the right choice. Clinical trials are super important. So, the treatments that we use today to have these phenomenal responses against cancer, the targeted therapies, the immune therapies, the fact that we're able to cure so many people of cancer is really because of patients that have gone before us. So patients that participated in clinical trials before really paved the way for these treatments to be approved and used today. And so we're really trying to focus on the whole person during their cancer treatment and not focus just on the cancer itself. Well, I'm pretty busy at work, but I may be even more busy at home. My wife and I have 2 small children, both under the age of 2, and so they kind of run us ragged around the house. As you can imagine, a lot of storybook reading, a lot of drawing. Elmo and Moana are superstars at our house. It's wonderful. We wouldn't trade it for the world.